again, everyone. I am Michaya Fe.R. Ampong, a Foundation Night Nursing student at Dumaguete City. Now, I will be doing the vital signs taking procedure. So, let's define first what is vital signs. So, vital signs taking is the manner by which the patient's temperature, pulse rate, blood pressure, and also her respiratory rate is taken and recorded. So, the equipment that we will be using on this procedure is a cotton balls, alcohol, our electronic thermometer, our aneroid sphygmomanometer, and lastly, our watch and stethoscope. So for the purpose of vital signs taking is to afford the opportunity to observe the general condition of the patient and also to observe as a guide in meeting the needs of the patient, and lastly to aid the physician in making his diagnosis and planning the patient's care. Now, let's do and take the vital signs of our patient. Come in. Hi ma'am, good morning. How are you? Okay ma'am, I am your student nurse for today and I will be taking your vital signs. And I checked the physician's order ma'am that I will get your temperature, your pulse rate, respiratory rate, and your blood pressure ma'am. Is it okay for you ma'am?
Yes, ma'am.
Okay ma'am. So there are some procedures ma'am that I will tell you what to do ma'am, and you just need to cooperate with me ma'am, okay?
Yes, ma'am.
Okay ma'am. I must do first my hand washing ma'am, and I'll be back ma'am, okay?
Yes, ma'am.
Okay ma'am, thank you. You must do hand washing before and after doing the procedure. Hi ma'am, I'm done doing my hand washing ma'am, and I must first close the door ma'am and also the curtains of your room ma'am to provide you some privacy ma'am while doing the procedure.
Yes, ma'am.
Okay ma'am. Okay ma'am, the door is closed and also the curtains are closed. Now ma'am, I will just put my equipments there ma'am on your table. Is it okay ma'am that I will use this table?
Yes, ma'am.
Okay ma'am, thank you. Okay ma'am, my equipments are ready ma'am, and I will do first my hand hygiene ma'am using my alcohol, even though I'm done doing my hand washing ma'am, okay? Okay ma'am, let's first get your temperature ma'am on the axillary part ma'am on your armpit, okay? Ensure that the electronic thermometer is in operating condition. I must first clean my electronic thermometer ma'am. We did our hand washing in the first place, and now let's proceed on taking the temperature. We must first clean our thermometer from the stem to the tip. Okay ma'am. Raise your armpit ma'am. Okay ma'am, can I let me see. I will just put this electronic thermometer ma'am and we'll wait for I will wait until it beats, ma'am, okay? Okay, ma'am, you can feel it.
Getting the temperature on the axilla of our patient can be used on uncooperative clients.
Okay. Let's see. Okay, ma'am. Raise your arms and you can. Okay, ma'am, your temperature is 36.1 Celsius and it's normal, ma'am. After using the electronic thermometer to our patient, we must sanitize it again.
If you are using a glass thermometer, you must wash the thermometer in lukewarm soapy water.
Now we are done sanitizing our electronic thermometer. Now let's proceed on doing our hand washing. After doing the hand washing, we must take note of the temperature that we have taken to our patient and report the significant findings to the physician. Now let's proceed on taking the pulse rate of our patient. Okay, ma'am, can you give me your hand? So we will be checking the pulse rate on her radial artery and we will be using these two fingers. We will count her pulse rate in 1 minute.
Assess the site where you want to take the pulse, taking into consideration the age of the client. While your fingers are still in place after counting the pulse rate, you must observe the patient's respiration. Note the rise and fall of the client's chest. Using a watch with the second hand, count the number of respiration for at least 30 seconds and multiply this number by 2. If respirations are irregular, count the respiration in 1 full minute. And also document respiratory rate on paper or flow sheet.
Okay, ma'am. Do you want to know your pulse rate?
Yes.
Okay, ma'am. So your pulse rate, ma'am, is 62 beats per minute, and also your respiratory rate, ma'am, is 13 cycles per minute. While I was taking your pulse rate, ma'am, I was also counting your respiratory rate, ma'am. And you did not notice that, ma'am? Okay, ma'am, that's good. Now let's proceed on getting your blood pressure, ma'am. Is it okay for you still?
Yes, ma'am.
Okay, ma'am. Before doing the blood pressure, ma'am, what did you eat this breakfast? Did you eat pork?
No.
Okay. What did you drink? Did you drink soda?
No.
Do you drink any medications?
No.
Okay, ma'am. So now let's proceed on taking your blood pressure, ma'am. Okay?
Yes.
Okay, ma'am. To take your blood pressure, we'll be needing this equipment which is named as the aneroid sphygmomanometer, ma'am.
And also our stethoscope, ma'am. Have the client assume a comfortable lying or sitting position. Select the appropriate arm for application of cuff. Expose the brachial artery by removing garments or move a sleeve.
And is ma'am, to put your sleeves at the top. Ma'am, that's it. I will just put this anorak sleeve on my monitor, ma'am, okay?
Ensure that your patient is not emotionally upset, is in pain, or has just
What would you prefer,
exercised.
ma'am? Standing or laying on the bed or taking the blood pressure?
Yes, down.
Okay, ma'am, just sit down. Okay, ma'am. That's it. Let's move on to the center area of your bed, ma'am.
Wrap the cuff around the arm smoothly and snugly and fasten it securely.
Is it too tight, ma'am? I will be using this stethoscope so that I can hear the tick of the aneroid.
Place the stethoscope earpieces in your ears. Direct the earpieces in the ear canal and do not against the ear itself. Place the bell or diaphragm of the stethoscope firmly but with a little pressure as possible over the brachial artery. You must tighten the screw valve on the air pump. Pump the pressure 30 millimeters of mercury above the point at which the systolic pressure was palpated and estimated. Read the pressure to the closest even. Note the point in the gauge at which the first faint, not clear sound appears and slowly increases in intensity. Note this number as the systolic pressure. Note the pressure at which the sound first becomes muffled. Also observe the point at which the sound completely disappears.
So your blood pressure is 110/73.
Remove the cuff and clean later and store the equipment. And after doing all the vital signs, you must do the hand washing.
Okay, ma'am, you can lay down now, ma'am.
Record the findings on the flow sheet.
Okay, ma'am, we are done taking your vital signs, ma'am. Your temperature, your blood pressure, your respiratory rate, your pulse rate, ma'am. And all the findings came out normal, ma'am. And may I ask, ma'am, if do you need assistance on that position, ma'am? Are you comfortable on it? Okay, ma'am. If you need my help, ma'am, don't hesitate to call me on that phone, ma'am. And I will report the findings to your physician, ma'am, so that he will be aware of what is your condition right now. And I will do my aftercare, ma'am, and I will head out. And first, I will just fix my items, ma'am, and go and head out to my nursing area, ma'am. Okay? Okay, ma'am. Thank you for your cooperation and also your patience while taking the vital signs. And may God bless you always, ma'am. And thank you so much for cooperating, ma'am. Where can I put my waste, ma'am? Do you have any garbage in here? Okay, ma'am. Okay, ma'am, I will be heading out. Thank you for your cooperation again, ma'am.
After doing all the procedures, you must wash your hands to avoid contamination and spread of microorganisms in our hands. Now we are done taking the vital signs to our patient.